There are many injuries that can occur during the application of the arm bar. In this short video, I want to discuss the two most common ones. Let's look at the relevant anatomy. The elbow joint is composed of three bones: the arm bone, the humerus, the forearm bone on the thumb side, the radius, and the forearm bone on the pinky side, the ulna. Zooming in on the bony anatomy, there are two bony protuberances of the humerus, one on the inside, the medial epicondyle, one on the outside, the lateral epicondyle. In addition, there is a ligament on the inside, the medial side, named the ulnar collateral ligament. Ligaments are strong bands of fibrous tissue which connect bone to bone. The biceps are primarily responsible for flexing the elbow, bending it. The triceps are primarily responsible for extending the elbow, straightening it. There are many muscles in the forearm. Some of them are responsible for flexing the wrist, bringing the fingers and the wrist toward the biceps. Others are responsible for extending the wrist, moving the wrist and the fingers away from the biceps. The flexors are attached by tendons. Tendons are strong bands of fibrous tissue which connect muscle to bone. These tendons of the flexor complex attach to the medial epicondyle that I showed earlier, and also the extensor tendons attached to the lateral epicondyle. We all know the mechanism. One jiu-jitsu athlete classically is on his or her back. The opponent uses the legs to stabilize the humerus, grabs a hold with his hands to the forearm or wrist, points the thumb in the direction that he wants to hyperextend the elbow, and then lifts the hips. This brings the humerus forward and the radius and ulna backward, hyperextending the elbow joint. The two most common injuries during an armbar is a tendon strain, STR, of the tendons of the flexor mechanism of the wrist. Strains can be graded in three grades. Grade 1, a stretching beyond the normal functional capacity. Grade 2, tearing of some of the bundles of fiber. And grade 3, a complete tear of one of the tendons. So, a tendon strain is the most common injury on the medial side. The second most common injury is a ligament sprain, SPR, a sprain of the ulnar collateral ligament. Grade 1, a stretching beyond its normal functional capacity. Grade 2, a tearing of some of the bundles of fiber. And a grade 3, a complete tear. Certainly there are other injuries such as dislocations, fractures, etc. It's important to note, anytime a joint is injured, it naturally wants to get stiff. So if you suffer an injury to your elbow, always be evaluated by your medical provider for a proper diagnosis and treatment plan. We all know how important the elbow joint is to the activities of daily living.